It's a great pleasure to discuss an exciting presentation at this year's meeting, looking at the genetics of cardioembolic stroke and atrial fibrillation. And this is a presentation from Barcelona, and we have Jara Cárcel-Márquez to talk about it with me today. So welcome, Jara. I'd like to start off just by asking you to put in the words for the non-expert what your research has involved and what the main findings have been.
First of all, just thank to the organizers, and it's a pleasure to me to be here with Professor Markus and the organizer of ESOC. And just mention that in our study we performed a multitrait analysis, which is basically a novel approach to combine studies of similar traits. In our study, we combine cardioembolic stroke and atrial fibrillation, with the main objective of uncover new novel loci associated to cardioembolic stroke due to atrial fibrillation. More or less, that's the idea of our study.
And you use this technique called MTAG that combines two genetic data sets. Can you just tell us a little bit about how that works, just for the non-expert, really?
Yes, we use a novel approach. Yes, MTAJ, we call that. It's a statistic approach that is combining related traits, but the main advantages in order to maximize the performance of a meta-analysis, because this is mainly a meta-analysis with a different considerations, is that it allows sample overlap, which is very nice in case that we are gaining a lot of data from multiple biobanks, but most of them have sample overlap. It's inevitable. And it's also give us information for the different traits that we are analyzing. So in our case, we had atrial fibrillation and cardioembolic stroke, and we will obtain the information for atrial fibrillation combined or enhanced by cardioembolic stroke and the other way around. So it's a very nice novel approach and statistic approach.
Thank you, and I think your data shows very nicely the power of the approach and how much information you've got from it. And one thing to add is how important it is that we have these publicly available genetic databases that you can use for this sort of research. So we're very grateful to all the groups worldwide who've contributed to these. One of the things that really interested me was that you suggested that there might be some atrial fibrillation genes that predisposed to stroke and some didn't. And I was just a little, I wondered how this might work. I mean, because they're all causing atrial fibrillation, which we think causes stroke. So why might some genes predispose to stroke and some not?
Yeah, we are not sure of the why, but we perform also another approach, which is called GWAS pairways. And this strategy gives us information of genomic regions that are influencing to the two traits or are independent, exclusively to one trait or to the other. And in our case, we obtained, I think it was 51 loci that were exclusive to atrial fibrillation. So what it comes to our mind is, well, there's a different pattern. We are seeing some atrial fibrillation risk that leads to cardioembolic stroke and some atrial fibrillation risk that are independent to the risk of cardioembolic stroke, or maybe we need bigger cohort, but we are really in the point that we don't see an association to cardioembolic stroke. And the interesting thing about these genes that are exclusive of atrial fibrillation is that in the pathways analysis we performed, they were mainly related to the development of the heart, morphogenesis, differentiation, development of the heart instead of the movement contraction that were more expected to be. These kind of pathways, action potential, contraction, movement, were associated to the genes that were atrial fibrillation risk, genes that give risk to cardioembolic stroke. So we were really seeing two patterns here. So we think our study is like a starting point for more research, because now we are seeing, well, there's two pathways here. We need to understand why these genes are really associated to cardioembolic stroke, and maybe these are the atrial fibrillation patients. We need to focus more than this in the clinical way, I mean. But it's an unknown answer until this moment.
Thank you. That's really interesting. Do you think that, there may be different types of atrial fibrillation where the rhythm is different and therefore it's more likely to cause thrombosis? Is that one possibility? Or, how could this actually work pathophysiologically?
Yes, I'm not an expert in clinics, of course, but I think that could be a reason. Although maybe with the I don't know how to say, but in clinics we can see this is an atrial fibrillation, but if we could explore that further, maybe there's two patterns of atrial fibrillation, but we don't know until this moment. Maybe because it's not possible until this moment, or maybe we can have a marker or something like that in the future. This information to see, well, there's two types. We don't know until this moment.
So yes, that's very interesting. One thing that's occurred to me is that there may also be genes that increase risk of stroke in those with atrial fibrillation that don't increase the risk of atrial fibrillation itself, such as genes that, for example, increase coagulation or thrombosis. Would your design have detected those, and do you think those are important?
We think it wouldn't, but this is mainly because we choose one of the causes of atrial fibrillation. There's plenty of causes of atrial fibrillation, of cardioembolic stroke, but we are only going to discover the genes that are associated to cardioembolic stroke due to atrial fibrillation in our study. In the near future, we are planning to perform several NTAJs with other causes of atrial fibrillation or related traits. In some of them that maybe are the alteration of the coagulation paths or pathways or things like that. I don't know which traits we are managing now, but in some of these traits we could see this. But using atrial fibrillation, no, we are only going to uncover genes associated to atrial fibrillation that leads to cardioembolic stroke.
Thank you very much. Now, your studies told us a lot, or is showing some really important insights into disease mechanisms. But one thing that people always ask about genetics is, is it useful to screen people with genetics, and can we predict risk? Where do you think we are with using this sort of genetic information to predict risk in stroke? And would it even be useful to identify those people at risk of atrial fibrillation?
I think it would be. It would be, but as soon as we can summarize the most genes or the most SNPs that are associated to the risk. In our study, as I said, we discovered SNPs associated to atrial fibrillation that leads to cardioembolic stroke. But we need to uncover more, and we need to, with this information, mainly perform polygenic risk score that could give us the information of ordering patients of higher risk that could be separated in the clinical part. But I think we are gonna be in this point. I hope in the near future. Let's see.
So it's promising, but we're not quite there yet. Is that what you would say?
A bit too low.
A bit too early at the moment. Yeah. So what is your next step? Have you got more studies planned in this area?
Yes, we have now performing polygenic risk score with our data, with promising results actually, and also with the NTAJ strategy, we are doing like I don't know how to say it, but we are trying as much traits as possible that are already known to be associated. But we are in the path to do that. I mean, it's time consuming when we are going from one trait to trying 200 or more. But let's see what we can obtain from this.
Thank you. No, that's really interesting work, and I've enjoyed talking to you about it. And I think it's a really impressive study. So we look forward to hearing more from you. And I think it really does show the power of these very large genetic databases. So for those people who are interested in research in this area, I mean, these databases are now freely available through organisations like the International Stroke Genetics Consortium. So we would encourage everybody to use them and get involved in this research. And thank you so much, Jara, for a very interesting discussion.
Thank you to you and for the organizers too. Thank you.